Hello. This is sort of a hopefully relatively brief update. I'm completely fucked. I had a migraine yesterday, so today is the post-migraine day, which is always lovely. Yeah, that sort of lingering headache, and just when you have fibromyalgia syndrome and you get migraines, you end up with a lot of sort of weird neuromuscular pain the next day. Like, it's just, if you can imagine like what your muscles feel like when you've done way too much exercise that following day, it's like that, only quite a bit worse. So yeah, I very much need to go back to bed and stay there and just not interact with the outside world today. But I don't get to because I have uni. I've got to do a presentation on cystic fibrosis, which to me is, genetically it's fascinating. Yeah, I've been speaking to a couple of people. Well, one woman who has, there's one mutation that causes about 70% of cases of cystic fibrosis. That's the most severe one that you hear about, unfortunately. But this woman has that mutation and another mutation that also causes cystic fibrosis in a milder form, so she's got it compounded. And then her daughter inherited her, that 70% mutation, but also another mutation from her own father. So she and her daughter both have different mutations that cause cystic fibrosis. It just goes to show how common it is to be a carrier. It's 1 in 22 Caucasians. So yeah, that's what I'm doing the presentation on today, so that should be good. At least I've done massive amounts of research. I always do far more work than is necessary to pass with these things, because I expect a lot of myself. My goal is always to hit 80% for any assignment I do, any test, anything like that. So, which is extra difficult when you have chronic pain. I'm booked in to see my GP tomorrow. I've got to talk to him about getting repeats for my endone, which it might be difficult. I've had to increase my dose for a little while, and when I saw my physiotherapist last Thursday, she worked really hard on my muscles, and oh my god, the pain was unbelievable after that. It's like my sacroiliac joints, the ones at the base of your back that are the reason I've been seeing her. It's like they sort of rebelled against all the muscles around them being released, I guess. And yeah, I still have a lot of pain in them, but it's a lot better than it was. It's a lot more manageable now. I can get by on my slow release mostly, and just one endone before bed. But yeah, this migraine thing, oh my god. I hate them. They need to be exploded from a great height, and then set on fire, and then jumped on, and then peed on. Yeah. But, yeah, one thing I wanted to discuss in this video is actually another condition that I have that isn't really related to chronic pain, but it does exacerbate my pain. October is Dysautonomia Awareness Month, and yeah, it's one of those terribly underdiagnosed conditions because the symptoms are so vague and they affect your entire system. Dysautonomia is dysfunction of the autonomic nervous system, and your autonomic nervous system controls all the stuff that your brain does without you thinking about it. So your blood pressure, your heart rate, body temperature, yeah, all that kind of stuff. Even things like breathing that you can do if you think about it, but you do it whether or not you think about it. So even stuff like that is part of the condition. We even have sort of depressed breathing while we're asleep. Fun, but yeah, the main problems for me with my dysautonomia are my blood pressure and my heart rate. I have what's called postural orthostatic tachycardia syndrome. It's sort of a subtype of dysautonomia. It means that when I stand up, my body doesn't compensate for gravity. It fails so badly. So when I stand up, my heart rate goes too high and my blood pressure drops. And the longer I'm standing, the lower my blood pressure gets. So if I'm on my feet for too long, especially if I'm standing still, because of course when you're moving, your circulation's better, that sort of thing, it's less of an issue, but it is still a problem. But yeah, if I'm standing still for too long, I will black out. I'll just simply fall over. And of course, when you're fragile and you have hypermobile joints, that can cause serious injury. Yeah, I've had so many really nasty dislocations and fractures because I blacked out. So, yeah, the main way it's treated, especially in people with Ehlers-Danlos Syndrome, because we have really poor vasoconstriction, yeah, is vasoconstrictive medication. So in my case, midodrine or midodrine, depending on who your doctor is. That one's fantastic. It's like my two wonder drugs really are Lyrica and midodrine. Yeah, it's phenomenal the difference it makes, because yeah, you know, the blood vessels don't constrict properly, so your blood pressure can't go up. It literally can't. That means blood actually pools in the lower half of my body when I'm standing. So there's, yeah, and also I have low blood volume. That's another thing that's part of dysautonomia, you know, for a lot of people. So there's pretty much no blood getting to my brain after a while, and your body has that shut-off mechanism where it goes, fuck, turns all the switches off, and you black out, because once you're lying down, everything equalizes again. So it's the theory is that it's kind of a defensive mechanism, but not a very good one. But yeah, yeah, the other medication I take is fludrocortisone, which is a type of steroid that forces your kidneys to hold on to more sodium. So when sodium goes through your system, it goes through your kidneys and you pee most of it out. But in my case, my kidneys don't hold on to enough of it. That's another thing that's, you know, part and parcel of dysautonomia, especially in EDS. Yeah, I'm really not sure why they suck so much, but yeah, forcing them to hold on to more sodium makes a significant difference as well. It also helps to keep me hydrated. Dehydration is a serious problem, especially when you've got low blood volume, because obviously it makes it worse. If there's less fluid in your system, you know, you can't maintain your blood volume. So yeah, those two medications are sort of the go-to for dysautonomia treatment. Yeah, and if you know anyone who gets sort of dizzy spells when they stand up too quickly, or, you know, has a lot of fatigue because, you know, you're not getting enough oxygen to your muscles and to your brain, if they get brain fog, if they get sort of really out of it when they've been on their feet for too long, not everyone blacks out when they have dysautonomia, but the symptoms can still be really problematic. Digestive dysfunction is a problem as well. Yeah, my stomach pretty much doesn't contract without medication to make it do that. So, yeah, if I didn't take the medication that, you know, that I do for that, I wouldn't be able to eat. For a long time, I couldn't. I lost an absurd amount of weight. I was extremely unhealthy. So that's the term for that is gastroparesis. So that's another part of dysautonomia. Technically, really, it's a type of dysautonomia when it's neurological. So these are all things that, yeah, if this rings bells with you and you don't have a diagnosis, please research dysautonomia and, yeah, talk to your doctors. I mean, they may not be sympathetic, they may not be understanding, but you have to fight for the proper assessment for this kind of thing. You know, I mean, unfortunately, not all doctors are familiar with these conditions. So, yeah, we have to push for these things ourselves. But, yeah, I'm going to end it there and go and practice my seminar some more, because my brain is not working today. But, yeah. Thank you for watching my video.